Good morning, everyone, and welcome. First, I want to thank Advanced Community Health for hosting us here. Thanks to Scott McCrae and his leadership. My name is Tom Roth. I'm a family physician, and I'm the CEO of Community Care of North Carolina. And I sit across from patients in the exam room. I work closely with physicians, payers, and state leaders. And I'm here to tell you that nobody is happy in this healthcare system. Everybody is struggling. We have simply a situation where healthcare costs are too expensive. A patient of mine goes to the pharmacy and defers a medication I just prescribed because she is choosing between that and her groceries. A patient of mine skips their appointment for an MRI, working up a worrisome mass, because they're running up against their deductible in a high deductible plan, and it's $2,200 out of pocket. A small business owner who just got their insurance renewal this week and sees a 40% increase from last year and has the gut-wrenching decision about whether to provide coverage to his employees or more likely to pass those costs on to the employees through higher deductibles and copays. The health plan that simply has no good option, raise premium or absorb costs that are unsustainable. And the administration and the legislature looking at rising healthcare costs within Medicaid and the state employees' health plan, and knowing that we're trying to serve more people with a finite budget and we've got other budget priorities. And the physician working hard in the exam room, drowning in paperwork, and seeing their colleagues needing to sell their independent practice because of rising costs, and trying to figure out how long they can hold out. The irony for me as a leader of CCNC and working with primary care practices across the state is knowing that primary care is really part of the solution to the affordability crisis. We know that access to comprehensive primary care and a usual source of care lowers healthcare costs and improves quality. But we struggle with capacity, we struggle with workforce, and we all know that wait times are increasing. With all of the financial constraints, we struggle to invest in primary care, and we know that if we can move healthcare upstream and focus more on prevention and keeping people out of high-cost settings, this would improve the healthcare affordability crisis. This is a system where everyone is burdened, where no one is winning, and it is a situation where there's no villains and no heroes. And usually in a situation like this, it is really the system itself that needs to change. This is a time to take action and to ask ourselves questions like, how did we get here? And what can we all do from all of our different corners to improve the healthcare affordability situation? So I really want to thank the governor for bringing us together today and thank our hosts. And I'd like to introduce the governor of North Carolina, Governor Josh Stein. Thank you.
Good morning, everyone. Pleased to be joined by Treasurer Briner and Secretary of Health and Human Services, Dr. Dev Sangvai. Dr. Roth, thank you for the introduction. Thank you for your leadership of Community Care North Carolina. Scott McCrae, thank you for hosting us at Advanced Community Health. And it's good to be joined by Dr. Tim Reeder, representative in the General Assembly, and we know he is busy this week. We're grateful that he's busy this week.
Representative Pointsy just showed up.
Oh, good. Representative Pointsy is here as well. Thank you, Alan, for being here. CCNC and Advanced Community Health are two organizations dedicated to getting people the health care they need when they need it. The work is critical because too many North Carolinians are struggling to afford their health care. I recently heard from a Johnston County doctor who told me about an elderly couple she cares for who both have chronic diseases. They kept coming back to her ED month after month, and she couldn't figure out why. Finally, the wife admitted that they could not afford the cost of the medication to manage both of their chronic diseases at the same time. So they traded off whose week it was to buy their medication, and whoever wasn't on their meds that week would just end up in the emergency room. The couple work their entire lives. They have health insurance, they have Medicare, but our healthcare system is failing them and too many others. How many North Carolinians are like this couple facing impossible decisions every month? How many families are pushing back medical bills that they can't afford or wondering whether that essential procedure is truly essential? How many people have checked their bank account balance while waiting in a doctor's waiting room? Healthcare is too expensive for people to get the care they need, and we ignore this problem of rising healthcare costs at our peril. Healthcare costs have consistently gone up more than the rate of general inflation over the past few years, and Americans are paying nearly 3 times as much healthcare expenses as they were just 20 years ago. And it's not just a North Carolina problem. All over the country, more than a quarter of Americans report postponing medical treatment due to the cost of care. We have a responsibility and an opportunity to take action. That is why today I'm establishing the North Carolina Health Care Affordability Commission. Treasurer Briner and Secretary Sangvai will co-chair this commission. Members will include experts from research, healthcare, medicine, insurance, and consumer rights, as well as elected officials. The commission will get to work quickly to align on a bold set of solutions that will address specific factors impacting healthcare affordability in North Carolina. Then they will provide recommendations for us for how we as a state can address these trends. The commission members will use data to inform their decisions so that the interventions they recommend actually lower costs. They will evaluate what's been tried in other states and the unique factors that impact costs here in North Carolina. They will consider how to improve competition, enhance price transparency, rein in rising drug costs, and promote the overall health of North Carolinians through primary care and value-based care. We want specific targeted list of interventions that have the real potential to make a difference in containing healthcare costs. This is a sensitive and complicated topic. This is an issue that is fundamental to our lives and well-being. And we all have our own ideas about why costs are rising so fast. But the goal of this commission is to listen to the data, do the research, and make recommendations. We have good reason for hope because we've achieved real progress on healthcare before in North Carolina. We saw this when we worked on a bipartisan basis a few years ago to pass Medicaid expansion. And now 730,000 of our neighbors have access to more affordable healthcare. We saw it just as recently as October in partnership with every single hospital in the state of North Carolina when we announced more than $6.5 billion in medical debt relief for more than 2.5 million North Carolinians. Now is the time for us to come together again to help more people afford the health care that they desperately need. It's a goal worth pursuing. I will now invite forward Treasurer Briner, then Secretary Sangvai to each say a few words. Treasurer.
Thank you. It's a privilege to be with you all today. I'm honored to serve as the co-chair of the Health Care Affordability Commission because I believe this is one of the greatest challenges facing families, employers, and the state of North Carolina today. It's not just an economic issue, it's a kitchen table issue. It's about whether people can afford to see a doctor, to fill prescriptions, or get the care they need without worrying too much what it will cost them. Here in North Carolina, I see that challenge every day through the lens of the state health plan. The state health plan provides health care coverage for over 750,000 North Carolinians, teachers, state employees, retirees, and their families. These are people who educate our children, keep our communities safe, maintain our roads, and dedicate their careers to serving this state. This service affects each and every one of us who live here. They deserve a healthcare system that works for them and not one that just becomes less affordable each and every year. Unfortunately, healthcare costs do rise faster than inflation and faster than the resources that people have to pay for them. If we simply accept the status quo, we're asking taxpayers and state employees to shoulder a burden that is truly unsustainable. That's not a responsible option, and it's simply not fair. I do want to take a second, though, to applaud our Republican leaders in the legislature. They have shown the initiative in the budget that is about to release to keep healthcare affordable for our members. We would expect a significant increase in funding for the state health plan in that budget. That's the second year in a row they have stepped up for the state employees. That means nearly $4 billion of taxpayer money this year into the state health plan on behalf of our state employees and retirees. If they had not fully funded the state health plan, premiums would rise by a further $38 per member per month, which is just a devastating number over and above everything else we've asked of them. But it's time for this group to put our heads together, look for sustainable solutions for affordability. You've seen a big push by my team and by the State Health Plan Board of Trustees to inject more competition into our healthcare system. Markets work best when consumers have clear information, meaningful choices, and when providers compete on both quality and on price. Too often, healthcare just doesn't function that way. In fact, it almost never does. We believe greater transparency and smarter incentives can help bend the cost curve while improving care. My team is committed to innovation. We're exploring new approaches in purchasing healthcare, creating incentives for higher value care, and finding ways to deliver better outcomes for our members. But this has to be done while protecting the long-term sustainability of the plan. Innovation isn't about change for change's sake. It's about making sure every dollar spent delivers better health and better value, which are the two basic components of affordability. Our hope is this task force will help us find even more new ideas and approaches to reach this goal. Most importantly, I want our state employees and retirees to know this. We understand these conversations are extremely personal. Behind every policy discussion is someone managing a chronic condition, caring for a spouse, raising a family, or living on a fixed income in retirement. You're simply not members of a health plan. You are public servants who have earned our respect and our commitment. As we take on these challenges, we are all in this together. I look forward to seeing what this commission can accomplish. My commitment is to work with transparency, to listen carefully, to pursue solutions that make healthcare more affordable without compromising the quality of the care you receive. Healthcare affordability will not be solved overnight, but if we're willing to challenge old assumptions, embrace innovation, and create a more competitive healthcare marketplace, I believe we can build a stronger, more sustainable future for the entire state of North Carolina. Thank you.
Good morning. Thank you, Governor Stein. I'm excited to be with you here today as we talk about the Health Care Affordability Commission. This is about understanding and ultimately improving the affordability of health care for individuals, families, employers, providers, and communities across our state. Today, we're launching the Health Care Affordability Commission, a statewide effort to bring data, transparency, awareness, and practical recommendations to one of the most pressing issues in North Carolina. It goes without saying that healthcare is essential. It supports our children, our workforce, our aging population, and it is an economic engine for so many of our communities. But for too many people, as you've already heard, the cost of care has become a barrier. Getting the right care at the right time is almost impossible. Across North Carolina, families are making difficult decisions about insurance premiums, deductibles, prescription drugs, hospital bills, and whether they can afford to seek care when they need it. As a family physician, I regularly fielded questions from patients about cost and affordability. Questions like, how much will it cost? Who will pay? Is there a cheaper option? And one of the hardest to hear, I can't afford it, doc. What happens if I don't do anything? Employers, especially small businesses, are working hard to offer health benefits while managing costs that affect wages, hiring, and competitiveness. Providers and health systems are also facing real pressures, including workforce shortages, uncompensated care, technology costs, behavioral health needs, and the financial realities of serving rural and underserved communities. Affordability is not a single problem with a single cause. It reflects how care is paid for, how prices are set, how services are delivered, how primary care and prevention are supported, and how well our system meets the people's needs. The Health Care Affordability Commission will help North Carolina develop a clearer, shared understanding of what's driving healthcare costs in our state. The Commission will examine affordability from multiple perspectives: consumers, employers, providers, insurers, public programs, rural communities, and state and local government. Its work will be grounded in data, informed by community experience, and focused on solutions to protect access, improve value, and support better outcomes. The goal is not to assign blame. The goal is to understand cost drivers, identify opportunities for improvement, and recommend practical steps that can make care more affordable and sustainable. Key questions that we're going to look at as part of this commission: what are the major drivers of healthcare costs in North Carolina? How do premiums, deductibles, out-of-pocket costs, prescription drugs, and medical debt affect the North Carolina family? Where do costs vary by geography, payer, provider type, and service category? What investments, such as primary care, behavioral health, rural health, prevention, care coordination, and addressing non-medical needs, can improve outcomes while reducing avoidable costs? The Commission's perspective must be informed by the voices of the people who live in North Carolina, and success begins with a shared fact-based understanding of healthcare affordability in our state. It includes identifying cost drivers that can be addressed without compromising quality, without compromising access, making workforce sustainable, and maintaining the financial viability of essential providers. It means recommending actions to help families better understand and manage healthcare costs and support employers, strengthen primary care and prevention, and improve value across the system. Most importantly, success means keeping people at the center of the conversation, because affordability is not an abstract policy issue. It affects whether North Carolinians can get the care they need. North Carolina has a strong healthcare foundation, innovative providers, committed public servants, engaged employers, and communities that care deeply about one another. We also have a responsibility, as all of the other speakers mentioned, to ask the hard questions about cost, value, sustainability, and to do with honesty, respect, and urgency. The Commission is an opportunity to bring people together, build a shared understanding, and develop recommendations that can make a meaningful difference for our state. And the Commission comes at a vital time as we're working through implementation of House Resolution 1 and our rural health transformation work. It is critical that we come together to ensure that everyone, regardless of where they live or how much money they make, can access and afford the care they need to thrive. Ultimately, it will take the collaboration of local, state, and federal partners to solve this issue so people can afford to get the care they need. I look forward to working with Treasurer Briner, members of the General Assembly, Director Walker, and other members of the Commission to do this important work. Our goal is to advance solutions that make healthcare more affordable, accessible, and effective for every North Carolinian. I would like to now invite Governor Stein back up to sign the executive order and celebrate this milestone.
Secretary Marshall is here to attest.
She's getting tired.
She will attest that I am on. I am in. This is to establish, this is Executive Order number 39, establishing the North Carolina Health Care Affordability Commission. Thank you very much, Secretary. Thank you. It's actually 3 pages. I have 2 hands. Okay, thank you. And we're happy to take questions. You can address Treasurer Briner, Secretary Sangvai, or me, whomever you wish. Yes.
A question for Treasurer Briner and then you, Governor.
Very good.
It's going to be the same question. Treasurer Briner, at the last health trustees meeting,
Yes.
you said that the rising costs of healthcare was largely a federal issue, decisions that the federal government has made or not made.
Yeah.
So that makes me wonder how much an individual state can do to really make some deep changes to lower healthcare costs.
Yeah. It's a great question. I think the operative word in the question is deep. I think we can make real progress for our state just on state matters. There are a number of things that I have in mind, and I'm sure the governor and the secretary have in mind as well, as do all the commission members, about progress we can make. But of course, to solve the U.S.'s healthcare system problems, the federal government has to take the lead there. But we can't wait for that. We have to take action in our own hands, do what we can for North Carolina, and support the federal government wherever we can.
The fact is that healthcare costs different Americans differently. Not every state, residents in one state may have fewer out-of-pocket expenses than residents in another state. And so that's going to be one of the tasks of this commission, is to try to identify what are measures that we can take as a state that can improve the cost for North Carolinians in this larger context of the American healthcare system, which obviously we as a state cannot control.
We've seen a lot of these kinds of things come and go. I mean, I remember study groups during the rollout of the Affordable Care Act about this kind of issue. What's going to make this different?
Well, we're going to work hard and we're going to work together. North Carolinians have shown that when we come together across our differences to serve the people of North Carolina, we can get things done to help the people of North Carolina, particularly in the context of healthcare. It was a bipartisan solution and agreement 3 years ago to expand Medicaid. 730,000 of our neighbors now have access to affordable health care who did not before. They are healthier, and struggling rural hospitals are stronger. We just announced last year the largest medical debt relief program in the history of this country. $6.5 billion benefiting 2.5 million North Carolinians. That's about 20% of the entirety of the state population got some medical debt relief over the last year or two. That was because 99 state hospitals partnered with the Department of Health and Human Services and nonprofit partners to do something that concretely improved the quality of life, the fiscal and financial, the financial and physical health of our people. And so we can do things when we come together, and that's what this commission is all about.
Governor, you mentioned the budget was just unveiled while you guys were speaking. What role have you played in kind of getting this across the finish line? Have you spoken with Speaker Hall or Senator Berger in the past few days? And also, is there anything that would hold you up in signing it once it's ultimately passed?
Yeah, it's premature for me to observe whether I will sign or veto it. We'll have to ask Representative Reeder and Representative Wauncey about what's actually in the thing. Representative Reeder assures me it is a great bill. No, we're going to be reviewing it incredibly closely in the coming days. What we want is for the state to pass a budget that invests in our people. And by that I mean making sure that our young people get the knowledge that they need in our K-12 schools so that they can choose to have a great career or continue on to college. We want to make sure that we're investing in people's safety so that parents don't worry when their kids are playing in the neighborhood over the course of the summertime. We want to invest in people's health so that folks are well, they can enjoy their lives, they can go about their daily life without worrying, am I going to be able to afford my medication this month or not? That's what's driving this commission. So there are many things that the state needs to invest in, and we will be scrutinizing it just as everyone else is to see if it meets that test.
Governor Stein, there's the provision in the budget that eliminates the Office of Health Equity. So I wanted to get your thoughts on that, or from Secretary Sangvai as well.
Yeah, we're still reviewing the budget, so I don't know. I can't speak definitively what is being done, eliminated, added to, or not. So we are going to review that carefully. And Secretary, I don't know if you wish to comment.
Similarly, we're excited that we're going to get a budget, but it's premature to comment on it right now. And as we review it, we'll be better prepared to respond.
Got time for one more question?
also, but in the budget, there's been efforts at the legislature to do things about healthcare costs. In the budget, there's a report on a study group on healthcare costs that looks at Indiana specifically, which is the first state in the country to regulate hospital prices. Are these kinds of things on the table?
We will partner with anyone, and I've heard that this provision's in the budget. I haven't yet read it. And if there are other folks who are looking at this issue of the rising cost of healthcare, we welcome it, because the whole objective of this organization is to put all of the ideas on the table. What will actually move the needle to lower costs for families so that they can afford the care that they need? And what will we do to contain healthcare costs so that it doesn't crowd out the rest of the state budget, because we have critical investments we need to be making in public education and public safety and infrastructure. And every extra dollar that's just an inflationary dollar that doesn't actually go to improve someone's health is a dollar less that we can spend on those other things. So we have a real need to get our handle on rising healthcare costs, and every good idea is welcome. Thank you all very much.